worried that this patient's worsening with the fever and his blood pressure is getting a little bit lower. I think we should go ahead and consult ID today.
And just to clarify, we're calling ID to ask if the patient's on appropriate antibiotics and if we need any other infectious disease workup?
Exactly.
Okay.
Can you please also let them know that we need to see him right now?
Yes, thank you.
Oh.
Hi, this is Ann.
Hey, this is Kevin, calling from ID, returning your page.
Hi, Kevin. I'm calling from the Gen Peds service because I have an urgent consult on a 3-year-old boy with 1 week of fever, limps, and rash who appears to now be in compensated septic shock, but I am concerned he is worsening. I would like to ask about specific antibiotics and additional lab workup.
Okay, Ann. Yeah, thanks. Go ahead.
He is a previously healthy male who has been having daily high spiking fevers for the past week, accompanied by a full body rash. Yesterday, parents noticed that he had a limp when he walked. On exam, he is febrile to 39 degrees, tachycardic to 120, and his blood pressure is 85/50. He looks very uncomfortable and has an erythematous maculopapular rash on his trunk and extremities. He cries when trying to examine his left leg. His labs are significant for leukocytosis, thrombocytosis, and elevated ESR-CRP. A blood culture from the ED is pending. I am concerned that his fever, limp, and high systemic inflammation could be secondary to an infectious process such as osteomyelitis, septic arthritis, or an abscess. Given his fever and tachycardia, we are worried he has sepsis and is at risk for decompensated shock. For sepsis, I am giving him a normal saline bolus now. He has been on IV clindamycin for the past 24 hours, but we would like to broaden his antibiotic coverage and would like your guidance on this. We are drawing a repeat blood culture, but would like help determining any additional laboratory workup. We are also planning to obtain an MRI of his bilateral hips and legs to look for an infection. Would an x-ray be helpful to start?
Thanks for that thorough consult, Ann. This child sounds acutely ill, and I'll be happy to come by right now. Help me understand why your team chose IV clindamycin.
So we started him on IV clindamycin because we wanted some MRSA coverage.
I am leaving my room now to head down, but as I'm there, for a quick teaching point, IV clindamycin would be a great choice here to cover for MRSA, but when we're worried about acutely ill children, my recommendation is usually IV vancomycin. Based off our antibiogram, we can get better MRSA coverage here.
Oh, perfect. Thank you so much. I'll switch him over now to IV vancomycin and I'll see you soon.